Hey A&Pers, this is Dr. Jones checking in. This is A&P1 Lecture Test 2 video 14. This is our last video for Lecture Test 2. Yay! Jazz hands. So we are talking about nails, fingernails and toenails, section 5.8. So nails are keratinized epidermal cells that protect the tips of your phalanges. Remember, phalanges are digits, include both fingers and toes. So nails are, that's the nail. Yeah, that's how that works. The nail body is the visible portion of the nail. The nail bed is the epidermis visible underneath the nail. And the lateral nail grooves are the little indents on either side of the nail grooves. And the lateral nail folds are the little bulges of skin, those little bits of skin on either side of the lateral nail groove, and you can see them here. Lateral nail groove is the little indent, and then the lateral nail fold is the little fleshy, bulgy bit laterally. And the nail body is, of course, the visible nail. And the nail bed is the epidermis under the nail. Okay. The free edge is the part you trim or file or chew if you must, but wash your fingers because there's lots of germs under your fingernails. So wash your fingers and wash under the nails if you must chew on them. And then wash them again after, because nobody needs your germs all over everything. And let's see, the free edge, the hyponychium. Okay, next slide. The hyponychium is, hypo means below, is this little wedge of skin here under the nail. So it's this little bit under the nail right there. It's kind of a thicker spot right there. And then the epo like EPI means above, hypo means below, is this little wedge of skin above the nail. So that's going to be your cuticle. Okay. I feel I should do my fingers facing down so it doesn't look like I'm flipping you off. I'm not flipping you off. You'll know when I'm flipping you off. I'm teasing. I don't usually flip my students off. I don't think I ever have in 10 years. Huh. Guess I just get the good students. The good students sign up for my class. It's kismet. That's all there is. Okay, so the eponychium is the cuticle. It's the part over the nail. So under the nail is eponychium, above the nail eponychium. So we're going to have to assume that this root means something about the nail, right? And then the nail root is this part of the nail that is deep inside the skin. It's deep, it goes into the finger. This, of course, is the bone, the phalanx, in the center of your finger. So it goes down almost to the bone. And eponychium, we said the lunula, let's go back a picture. The lunula is the little moon. Right there. La luna is the moon. It's a pale crescent near the root. Okay, next page. The nail body, do I have another picture? Oh, keloid. And then, okay, not there yet. All right. So the nail body, which is the visible portion of the nail, consists of dead, tightly compressed cells packed with keratin. You may recall that your skin is keratinized, stratified squamous epithelium. I certainly hope so, because you haven't taken the tissues test yet. Your skin is keratinized, stratified squamous epithelium. And the, excuse me, the nail is made of cells that are completely packed with keratin and densely packed with keratin and compressed together like your hair. And there's room for you to draw a finger My art is super terrible, and you can do probably better than that. On minimum, if I can draw it, all y'all can draw it. So, all right, let's talk about injury repair in the skin. There we go. And there's a keloid. We'll come back to that. Let's see, move me out of the way. Boom. Step 1 is the inflammation phase. The inflammatory phase, that's when you do the blood clot scab formation. So once you've cut, clearly you'll have to cut into the epidermis or it won't bleed. If you cut in just the epidermis, it won't bleed. So it has to cut into the dermis, sorry, for it to bleed. I don't know what I said the first time, but if it doesn't cut into the dermis, it's not bleeding. Okay. So the bleeding, the swelling, the redness, the pain, inflammation is from the mast cells. Mast cells release the inflammatory chemicals. Thanks, right? Step 2 is cellular migration. This is the migratory phase. And what happens are these basal cells, these stem cells divide until they are lining the entire wound. So they are migrating by dividing in this direction, by creating new cells on the edge of the wound. And also the scab forms. The blood clot is called a scab. Scab is a blood clot. And cellular migration, and you line it with stem cells, epithelial stem cells. And then step 3 is the proliferation phase, where the epidermis, the stem cells grow a layer of epidermis. So you have a layer of epidermis over this granulation tissue. And then 4 is the scarring phase, the maturation phase, where you have epidermis over scar tissue. The scar tissue is largely fibrous, so it's never as flexible as the original skin was. So, and it's usually a little indentation, although in some individuals the scar does not quit growing until it literally runs out of space under the skin, and that is called a keloid. And keloids are often just cosmetic, but occasionally they can, scar tissue can overgrow and cause issues with nerves or important things like seeing or hearing, and then those are usually surgically removed. Is my hair wonky? Okay. Surgically removed, although they often grow back. So, but it does, by surgically removing them, you give a period of functionality without the keloid while it is growing back. So there's that. Okay. Step 4. All right, quiz. Hey, there's a quiz. I'm guessing we start here like we did last time. There we go, epidermis, and probably this one next. Excellent. And last time it was this one third, we'll see. Nope, it was this one this time. That's why I never can remember which one's next. Okay, so what's the deep layer of the dermis? Excellent, and below the dermis is the... Ooh, can you give all 3 names? Subcutaneous layer, hypodermis, and superficial fascia. Let's move me out of the way. Which part of the hair is that? Hair shaft. And what's this bit? Sebaceous gland. And the smooth muscle that gives you goosebumps? Erector pili muscle. And what is this organ? Hair follicle. Now this one we did not cover in lab, so this is new, and these are your sensory nerves. These are nerve fibers. They go to sensory nerve endings here, here's some. There's different kinds of sensory nerves. They go around There's a nerve plexus around the hair root, and that's how you can feel when you move your hair without touching your skin. And then this whole lumpy here is the sweat gland. And I don't remember which next, the two together or the red one. So what's the red one and what are the two together? All right, the two together are the cutaneous plexus. And the red one's always, not always. The red one here is an artery and the blue one is a vein. And where they meet together, the artery and the vein meet together, was a capillary bed. That's right, capillaries. And the yellow stuff in the hypodermis is adipose tissue. Excellent. Okay, and aging, the effects of aging. Let's go back because this looks like we're done. So the effects of aging, the epidermis thins, increased risk of injury, increased risk of infection, a decrease in immune function, a decrease in vitamin D3 production, which will affect your bone strength as you age, which causes a decrease in calcium and phosphorus absorption, decreased gland production, so less skin oil, so drier skin, and less sweat, so harder to cool off. A decreased blood supply, fewer hair follicles, your hair gets thinner, the melanocytes don't work as well, so your hair goes lighter, turns white. The dermis thins with less elastin and more wrinkles, especially if you've had lots of sun exposure. And you get a decrease in secondary sex characteristics and a decrease in skin repair. So there you go. And that is sunset from my backyard. And that was before Harvey because the well was still there. Harvey knocked it over. So it doesn't work. So there you go. That is, that's it. Yay, that's all of lecture test 2. Thank you as always for tuning in. It's excellent to virtually see you here. I appreciate that you all are keeping up and watching all the videos. You are doing great. Keep it up. The education must go on. Dr. J out.